Hi, everybody. I'm Jeff. This is Jody. And I wanted to introduce Dr. Earl Robinson because as a kid, I lived just up the road from him, like 2 miles up. And what's amazing with Dr. Robinson, I have so much respect for him, and Jody does too, is he took his own money and he put $50,000, this is a while back, of his own money to try to keep radioactive drill cuttings from going into the Chemung landfill. And he spent more money since then, and this is out of his own pocket. And I remember Dr. Robinson, when he said to me, he said, you know, this guy saves people's lives all the time. And he said to me, he said, I'm working overtime all the time to pay the legal fees to try to protect his area down there around the landfill. And so how many people do you know that would be doing something like that? It's just remarkable. So I just love this guy.
We both do.
We both do. And so with the greatest respect for Dr. Robinson, please come on up here. This guy is one of my heroes, big time. So.
Thank you, Jeff and Jody. I think their words are wonderful, but their actions speak beyond their words. And you've seen all that. I take some responsibility for this area of New York State, having been here for 34 years now. I was born in Albany and grew up in Rome, New York, where I spent most of my days out in the hills and valleys of the Tug Hill Plateau, trout fishing and chasing deer and that sort of thing. And the only time I spent outside of New York State was when I was physician to Congress in the Navy for 2 years, and then did my pulmonary fellowship in Maine Medical Center. Then I returned to the southern tier rather than going up north where the snow piles up 3 or 4 feet. Although occasionally we get that here too. When I first got here, I was trained in pulmonary and critical care, which is something that nobody was trained in this area. So I set out to get privileges at 6 of the local hospitals. So I have privileges in various counties in the southern tier, and therefore I feel responsible for these people who are going to be impacted by whatever is going to happen to us once this drilling starts. I can protect my patients from certain things, and I spend a lot of time talking to them about avoiding smoking, exercise, taking their medications, etc. But I can't protect them from the environment. And the environment that we live in is not that good to begin with. We're talking a lot about what's going to happen. I live about a half a mile from the Chemung County landfill, and the county decided it was going to privatize the landfill and then let a private garbage company, Casella Waste, take over, which to them seemed like a good idea because they knew, the county, that the landfill was being invested by the state's attorney general's office for civil and criminal penalties associated with dumping lead in there by Kennedy Valve, and they wanted to get rid of that hot potato. So they let them come in and take over and let them do whatever they wanted according to the contract. So we took the county to court about that, saying that this was not a reasonable thing, but politics will out. They managed to do that. Subsequently, one of my neighbors came to me and said, gee, Doc, I was down at the dump the other day talking to the manager, and I asked him why all those trucks from Pennsylvania were coming in. And he said, oh, that's the drilling mud from the Marcellus drilling. And I said, what? Don't they realize what's in that stuff? Oh, I guess they don't care, Doc. And I said, well, I care, and we need to do something about that. That's when we took the landfill to court and brought in a radioactive expert and some other people to look at this. And the radiologic expert said that this Marcellus contains radium 226, uranium, arsenic, lead, strontium, et cetera, and that if that stuff is put on the dump, the workers will be exposed to that because they're pushing that stuff around with bulldozers and scraping it up and blowing it in the air. And then when the rain comes, the leachate, the garbage juice that comes off of that will go into a leachate pond, and that will then go to the county sewer plant. Now, some little time before that, I was on a canoe trip down the Chemung River, and I ran into some guys who are engineers that take care of the sewer plant. And I said to them, I said, you know, this fracking thing is going on. I said, how are they going to get rid of that stuff if they take it to a sewer plant? And these engineers that take care of the sewer plant said, you can't remove radioactive waste or heavy metals in a sewer plant. The only way you can do it is evaporation, and then you have to take the stuff someplace else. Well, here we are doing it anyway, and I'm saying this is probably not a good thing. But as you've learned already, the EPA has decided that any kind of drilling waste is exempt from any kind of regulation. So it's not hazardous waste. When it comes out of it, if it came out of someplace else, it would be, I suppose. You know? Now, currently, in our county dump, we don't take our garbage there anymore. Our garbage goes up to Seneca Meadows so that the drilling waste can come in from Pennsylvania. Now, this Marcellus was formed 350 to 450 million years ago in a shallow sea, 15 degrees below the equator. And then with the tectonic plates moving, it's moved up into the North American continent, where it surfaces at Marcellus, New York. That's why it's called the Marcellus. In Marcellus, New York, there is not a building that doesn't have a radon level higher than EPA standards that would not need remediation because it's sitting right underneath the buildings. That's where radon comes from. Radium in the Marcellus. And you hear these people say, oh, there's nothing wrong with this. You could build a school on top of it. You could put your house on top of it. It couldn't hurt you. Yeah, I suppose. But what about the radon gas coming up through there? Now, as stewards of the environment, we haven't done a really good job. Some of my Iroquois friends were pushed out of this area and were no longer in charge of what was going on in 1779 when the Sullivan-Clinton campaign came through and eradicated their homeland. Immediately, we cut down all the trees. Then we started extinguishing the eagles because they thought they were going to eat something. We got rid of the elk. We even killed off all the deer in New York State, such that by 1900 there were no deer here. The only deer that were left were up in the Adirondacks, and we were chasing them with dogs in the winter to get rid of those. It was only until the 1930s that the deer came back here. The grizzly bear's gone. We even killed off all the Canadian geese. The Canadian geese that we have now are here because farmers captured them and used them for decoys to bring the other geese down. And that's why we now have Canadian geese that eat corn and grass and that sort of thing, which they never did before. The turkeys were eradicated. We had to bring them back by trapping, etc. I could go on and on and on. And of course, you could drink the water, you could eat the fish, you could do all this other sort of thing. You can't drink the water now. And how many fish can you eat? I was doing a little study the other day, and I looked on the internet to see whether I could go to the Great Lakes and catch any fish and eat them. And they said, you better not. But one of the things that happens is the youngest embryos of fish, birds, and humans are most likely to be impacted by chemicals and radiation. The American Red Cross did a study on cord blood on newborn infants and looked at what kind of possible chemicals were in that cord blood, and they found PCBs, and they found petroleum distillates, and they found other chemicals which should never be there. And obviously the mother had contact with those sorts of things. And that's how you're starting out now today. And then you're being exposed to all these other things. And we're seeing more and more types of congenital type diseases. We're seeing more and more problems with ADD, ADHD, blah, 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 in children. And we don't know where this is coming from. Now, my job as a physician is to take care of my patients. I try to protect them from whatever's going to happen. I can't protect them against something which I have no knowledge of. Now, if somebody comes to see me and they've got a headache and they're nauseous and they've been vomiting, I can do a certain number of tests to try to find out what's going on. But if they've been exposed to these chemicals that you've been hearing about, how do I test for them? There are no tests that are available locally to test for the kinds of chemicals you're talking about. First of all, you don't know what's in the water, what's in the fracking fluid. You don't know what's coming back. You don't know what kind of exposure they've had. And then when they have symptoms, you don't know what those kinds of chemicals can cause those kinds of symptoms. Now, if you do make a diagnosis and somebody has a disease that is related to those things, how do you treat them? What do you do? So when we develop a medication to give somebody, first of all, we try to make sure it's safe. And we go through several trials. And then the FDA has various divisions of trials that you have to go through in order to establish that a medication is safe to give to people. Has anybody done any kind of studies at all to see whether any of these chemicals are safe or what's going to happen to animals or plants or humans? No. So what happens in the industrial scenario is first you expose them, then they get sick, then there's a lawsuit, and then you go back and look and see what happened. That's totally backwards. If you develop cancer, it's because you've had an injury to your genes or your chromosomes. Now, right now, if you go out in the sun and you get irradiated for a day and you get sunburned, you're not going to get skin cancer, probably. If that happens over and over again, you will. If you have some chemicals in your body which inhibit your body's ability to repair the damage that's been done, then you will have more damage. So the more chemicals and the more exposure to carcinogens that you have, the more likely you are to have a problem, because that gene can't, and that chromosome can't repair itself. So when it divides the next time, it divides and it produces an abnormal cell. That's how you develop cancer. And if your body's regulatory system, which kills abnormal cells, it actually kills cancer cells. If you make a cell that's abnormal, it will kill it, if it has the right material available to do that. So my problem with this whole thing is that I can't get a handle on this. I can't protect my patients. I can't diagnose them. I can't treat them. I can't prevent any of this if once it happens. So I'm hoping it won't happen, but it's happening out there. Anybody have any questions about anything? Yes?
Any research on the health of gas workers?
No, but they're starting to do that in Pennsylvania right now. They're looking at impacts on communities, on gas workers, on all that sort of thing. And obviously that's something that should have been done a long time ago. I think if you look back 2 years ago, you never would have thought that we could have gotten this far with this thing, the way things started. But everything's sort of coming together. I know Walter Hang is saying there's only one way to do things, but as you all know, by working and educating, that's the most important thing with this whole thing, is to educate people as to what's going on. Every time I come to one of these, every time I get on the internet, I learn something new, something more helpful. If you talk to even healthcare workers, they have no clue what's going on. And the general population is totally in the dark, and that's why they get away with these things. as I was telling somebody earlier, you know, the gas companies came in here 20 years ago. They were signing up the land at $5 an acre. And last time I talked to one of my patients who actually is a landman in Pennsylvania, he said, the large landowner coalition there, the last contract was for $6,500 an acre and 20% royalties because people knew what was going on and they demanded that much. Unfortunately, that doesn't stop, you know, what's happening. Yes, any other questions? Somebody? Yeah.
When somebody gets injured in a drilling accident right now, I've heard reports that the gas companies actually bring in their own crews so that they try to hush up whatever's going on.
Only makes sense.
Have you heard that
Yeah,
too?
yeah. Well, so here's a scenario. You have a drilling accident. The workers are injured, fire, they're covered with, every one of them. I have patients coming in, they're just covered with petroleum distillate. They're black. They you know, they walk in the door of the whole office, you know, you can smell it. And if there's an accident, let's say your local ambulance company has to go out to take care of this. They need to know what they're going to be exposed to. They need hazmat suits. They need chemical, you know, sheets. They're not given that information. And that's why, and then you bring the patient to the hospital, you've got to close down part of the hospital because you don't know, the emergency room, because you don't know what kind of chemical exposure this person has had, and you don't want anybody to be exposed to this. There was a nurse out west at a certain hospital who was in the emergency room with her gloves on. Patient came in as a gas worker, injured, covered with petroleum, whatever. Took the clothes off the patient. The next day, that nurse was in the intensive care unit on a ventilator and kidney failure from some type of exposure to some type of chemical. How do you treat somebody like that? You don't know what it is and you don't know what's going on. Anybody? Go ahead.
We certainly appreciate all the work that you have done and you are doing. But my question is, where is the rest of the medical community along with you?
They're clueless. Now, the State of New York Medical Society has, and Tompkins County Medical Society have put forth a directive that they're against, you know, fracking and, you know, that kind of thing. But don't, I'm sorry, don't give your local physician credit for knowing what's going on. Okay, he's got his head buried, and the state of New York and the federal government and everybody else is keeping his nose to the grindstone. He has no time to read the newspaper most of the time. He has no clue what's going on. So you can help by educating your physicians and telling them what's going on and ask them in that short 5 minutes that you have with them, you know. Yes, sir.
Just to share some information with this group, Mount Sinai Hospital is looking to see people who are suffering symptoms from chemical and radioactivity exposures as a result of gas drilling, to evaluate them with an eye to developing a long-term study and developing a protocol for health care for people living in these areas. So if anyone wants more information about that, contact them.
Okay.
I also wanted to bring up another point, to see what you think of this. In the pharmaceutical industry, where they develop new products, they conduct trials, and people sign up for these trials, and they're given informed consent, they have to sign releases. And would you think that it would be fair to say or argue that the industry, by proceeding the way that it is, particularly in northern Pennsylvania, setting in motion a medical or health situation, and people are being forced into this environment against their will, and how would you compare the two situations?
There's a guy at University of Pennsylvania, Conrad Volz in Pittsburgh, who is studying the health effects of this whole thing. He's got a grant from the Heinz Foundation, And that, unfortunately, won't be available for a while, but it will come out soon. And again, you know, it's a totally different scenario. It's one thing if it's a medical thing, if it's a pharmaceutical thing, it's another thing if it's an industrial thing. They have a whole set of different rules. And in New York State, just quickly, because I'm running out of time, I just mentioned, all of the different divisions of the state health department cannot tell the DEC what to do, cannot tell the prison system what to do. Every state department is totally individually separate organization, makes its own rules and regulations. The state health department has told the DEC that this is dangerous stuff, that you have to do this, that, and the other thing. But the DEC doesn't have to do that. Yes? Okay. No.
It's Chemung County, correct, that you were referring to, the
Right.
dump?
Yeah.
Now, are they still taking that waste?
Yes. All of the
Okay.
Casella dumps are taking the drilling waste.
Is that because that's a local,
That's
what's the jurisdiction?
That's because they can. DEC has said, because the EPA says that this is not hazardous waste, that it doesn't have to go to a hazardous waste dump.
Okay. The other thing that was interesting, our local doctor, Adam Law, testified in Albany recently, and so did Mrs. Steinbrenner. I was curious why there isn't more of a movement, and that question was just answered. I mean, with all these health issues, why emergency responders, doctors?
It's all about time.
Well, I'm wondering, because just the other day, one of the people that is one of the movies was talking about his blood being given to his local doctor in Colorado, who basically squandered the blood and sort of denied his problems. And I'm wondering whether how much of the industry is infiltrating the medical society. Could that be happening?
No, not that much, but they do put things off. My worst experience was coming to Elmira as a pulmonary physician and treating people with lead toxicity, working at a local foundry and having to chelate them, give them injections in their butt to try to get the lead out of their body. And when I talked to the industry and said, look, you're contaminating your workers, you need to get this stuff out of the shop, they said, we'd rather treat them and not pay for the $1 million worth of stuff that we'd have to take care of. And I said, well, you know, that's totally inappropriate, at which point they fired me because they were paying me directly, not through an insurance company, so there would be any record, and sent the patient someplace else.
Thank you.